Hello everyone, my name is Nicholas Spino. Today I'll be presenting 5 leadership performance measures related to the management of health informatics. Each measure comes from peer-reviewed research or academic sources and includes examples, impacts on patient outcomes, and the unique challenges and opportunities leaders face when applying these measures. Our first leadership performance measure comes from Aramararan's dissertation. This measure focuses on how leaders use and oversee quality performance measures, or QPMs. Essentially, leadership success is determined by how well leaders track, analyze, and respond to measurable indicators tied to health informatics performance and clinical quality. Quality performance measures help leaders judge how effectively digital systems function. By consistently monitoring metrics like alert accuracy, documentation quality, or workflow efficiency, leaders can identify gaps early and guide system improvements. This supports safer, more reliable informatic processes. In example 1, leaders track electronic health record related metrics such as medication errors, alert response times, and duplicate orders. By responding to these metrics, they reduce medication errors by adjusting decision support alerts. This demonstrates the power of data-driven leadership on patient safety. Example 2 focuses on data quality metrics, things like allergy completeness, problem list accuracy, and duplicate record cleanup. After monitoring these, leadership improved data accuracy, which strengthened downstream analytics for population health management and reduced adverse effects linked to missing allergy information. Overall, quality performance oversight leads to better informatics processes. It produces fewer medication errors, more reliable clinical data, and more effective clinical decision support. When leaders use QPMs consistently, patient outcomes improve because safety risks are reduced and care becomes more coordinated. Challenges include selecting the right metrics, ensuring data accuracy, and overcoming staff resistance to workflow changes. But the opportunities are significant. Leaders can use QPMs to create a culture of continuous improvement, justify informatics investment, enhance efficiency, and identify risks before they escalate. Our second and third measures are from Lemack and colleagues in 2024. It includes the alignment of digital strategy with the organization's mission and culture. This evaluates how well leaders integrate informatics into the overall strategic direction of the organization. It also includes how well leaders integrate digital health and informatics into the organization's mission, governance, and culture. This turns digital information into an everyday expectation instead of a side project. In example 1 for strategy alignment, leaders revise the mission statement to include digital access and predictive analytics. They then embed digital governance into board and executive team processes. This leads to stronger adoption of telehealth and analytics, reducing readmissions by 8% in 1 year. In example 2 for strategy alignment, the CEO models digital leadership by making digital day rounds to gather clinician feedback. This cultural reinforcement leads to a doubling of early warning system usage and a 12% reduction in sepsis mortality. The challenges include low digital literacy among executives, resistance to culture change, and difficulty measuring alignment. However, this measure offers major opportunities. Leadership can elevate informatics from a tech project to a strategic driver, increase return on investment on digital tools, and accelerate innovation across the system. In example 1, leaders revise the mission to emphasize personalized, data-driven care. They create a digital health governance board, which results in broader adoption of analytics and a 4% reduction in hospital length of stay. In example 2, leaders run a digital culture survey to find resistant units. Targeted support boosts advanced electronic health record module use by 30%. Changing culture is one of the hardest parts of leadership. It's slow, complex, and sometimes difficult to measure. But once digital culture is embedded, it leads to improved interoperability, stronger innovation, and resilient, data-driven care environments. Our fourth measure is transformational leadership, and it comes from Chialo 2018. This measures how well leaders inspire, motivate, and engage teams during health management information systems implementation. Transformational leadership was strongly linked to successful health management information systems integration. Example 1 shows how transformational leaders engage staff in HMIS adoption through shared decision-making and cross-unit communication. This leads to more accurate records and faster data availability. Example 2 demonstrates how transformational leaders promote innovation and system-wide integration, improving population health monitoring and public health responsiveness. Challenges include leadership fatigue, limited training, and variability in leadership styles. But transformational leadership offers major advantages such as stronger staff engagement, smoother HMIS integration, better data consistency, and ultimately, better patient outcomes. The final measure comes from the Canadian Journal of Nursing Informatics. It evaluates leadership based on informatics competency, or how well nurse leaders understand and apply digital tools, data workflows, and interoperability concepts. Example 1 shows a nurse director with advanced informatics training who redesigns documentation templates, improving interoperability and reducing communication errors by 18%. Example 2 shows a CNIO who trains unit managers to use real-time dashboards, resulting in a 12% reduction in patient falls. Challenges include limited informatics training for leaders, difficulty measuring competency, and resource limitations. Opportunities include stronger data-driven decision-making, better interoperability, more effective predictive analytics, and improved workflows and outcomes across nursing and clinical areas. Leadership performance in health informatics can be understood across several interconnected domains that directly influence data quality, system adoption, and patient outcomes. Leaders who effectively oversee quality performance measures help reduce medication errors and strengthen clinical decision support systems. Those who align digital strategy with mission and culture create environments where AI-embedded tools and telehealth systems are prioritized, leading to reduced readmissions and mortality. Leadership that integrates digital health into organizational culture and governance fosters broader adoption of advanced electronic health record functionality and supports sustainable system-wide transformation. Transformational leaders accelerate health information system integration, resulting in improved record accuracy and timely care delivery. Leaders who build strong informatics competencies enhance interoperability, reduce workflow errors, and support real-time, data-driven clinical decisions. Together, these leadership performance measures strengthen how organizations design, implement, and optimize information systems. They elevate data quality, empower the workforce, and build healthcare organizations that are more innovative and resilient in a rapidly evolving digital landscape.